Hey guys, today we're going to be talking about teaching and learning with our patients. And I'm very passionate about education, obviously. Um, it's just so important that we have good relationships with our patients and exhibit good communication so we can provide them with the education that they need when they're going home or before surgery. There's a lot of good teaching moments that we're presented with. But you have to remember that although a nurse can influence and promote positive healthcare outcomes, we can't control their actions through education. We can't control what they're going to do when they leave. We can't control the situation that they're in. So just know that patients will not always follow the recommendations, and it's important for us to understand that there are factors outside of the hospital, clinic, surgery center, wherever you are, that affect a patient's ability to access maybe resources or even healthcare information and to put it into practice. I took care of a lady once who needed this. She had a blood clot and she needed this medication for 5 days. They were going to go ahead and let her go home, but she needed to take this medication for 5 days to make sure that the clot continued to dissolve. And she refused to take it because of the cost. And it was going to be a little bit costly. I want to say like $60 a pill. And to me, I was, obviously that would be worth it. But I didn't know, it's hard for us to understand what their outlying factors are. What her financial situation is. And so social work really worked with her to try to get that taken care of. But I think you'll come across several situations like that where patients make decisions and maybe you don't agree with them, but we always have to remember that it's our job to convey the facts and give them the education that they need, and we can't control what happens beyond that point. So there's different types of education: patient-focused, holism, negotiation, and interactive. I'm not going to read those to you. These are slightly out of order from what's in the book, but you can find them in there. This is in chapter 15. You should always allow the patient to share their beliefs or their preferences. It really helps us understand the patient better, and we can individualize their teaching needs. It's really important to listen to the patient. I had a patient once in the ER who was a heroin addict, and I was getting ready to start an IV on him, and he said, "Oh, I've only got one good one left. It's right here." Well, of course, that's where I stuck him. That's not typically maybe where I would have went for an IV in the ER, but I listened to my patient, and by golly, he knew what he was talking about. So what is learning? Well, it's the acquisition of a skill or knowledge by practice, study, or instruction. There's different conceptual models of the learning process. Most recent studies suggest that the core of effective teaching is to produce capable self-learners. Okay? A lot of you are probably self-learners. We want them, though, to continue to learn beyond what we've taught them, right? So if we teach them about maybe a blood pressure medication, we want them to be curious enough to continue to learn and continue to follow what we've taught them. An example of that is what you guys are learning in patho and pharm. It constantly builds on each other from previous knowledge of chemistry, anatomy, etc. So that's the type of learning environment that we want to create. There's different domains of learning. You should definitely know these. Cognitive, affective, and psychomotor. These come right out of your book. So psychomotor, you're performing a new skill or procedure. Maybe we're teaching a patient how to give an insulin shot. Okay, that would be psychomotor. Affective, domain of feelings and emotions, involves changes in beliefs. And then cognitive, this is probably what you think of most when you think of teaching and learning, but you're learning facts, reaching conclusions, and solving problems. It's really important that we assess our patients for learning. This might not be something that you've thought of before, but knowing their baseline knowledge, their culture, is there a language barrier, and what their priorities are is really important. Especially, let's talk about like maybe if we're teaching someone about diabetes. So maybe they're from another country and their diet is different than what we're used to. Maybe the foods that they typically eat are different. That would be an important thing to know before we go in and teach them about diabetes and how you should eat. Another thing you can assess is motivation, compliance, sensory, physical state literacy level, and health literacy level. So these are different things we can assess for learning. And we really don't have any control over things like motivation, but it's something that we can kind of have an idea of before we go in the room and teach the patient. Other factors, we want to look at their energy level, their comfort, their age. Okay, if the patient is 92 and has dementia, how effective, I guess I should say, is our teaching going to be? Maybe we should have a family member in the room. Or the patient's emotional state. Maybe they just got some bad news. Is that really a good time to come in and talk to them about their diet? Probably not. So these are some other areas that we can look at before we teach. So I kind of already mentioned motivation, but think about things that could change somebody's motivation. Maybe their attitude or their belief, maybe financial problems like that story I told you earlier, inconvenience, denial, lack of support. Those are things that would affect somebody's motivation. Compliance, think compliant versus non-compliant. It could be affected by pain, anxiety, financial restraints, things kind of a lot the same of motivation, really. But if you have a non-compliant patient, people can be non-compliant after all the education in the world. And then sensory and physical state. So if you have a patient with poor vision or compromised fine motor skills, they may be unable to give themselves injections. Okay, so if they don't have good vision, how are they going to see the syringe to drop the insulin for diabetes? So those are some things that could inhibit learning. Literacy level. I think you would be shocked to know what the literacy level is. I don't know what it is for this area right here per se, but when I worked at a level 1 trauma center close to here, we were told that the literacy level in the area was 4th grade. And so when we were giving education to patients in the emergency department, it was really important that we didn't talk above people. And that's hard. I find that hard sometimes when teaching, that I'm talking above students. Even in the emergency department, I think it would be even harder to keep it on the same level. There is a box in your book that talks a little bit more about this. I highly suggest that you go look at that as well. It's important to individualize patient teaching. Here's some factors to consider. We've really touched on most of these, but maybe including a family member. Make sure you have good timing. Language translation needs. Maybe they need a translator to help. Learning style preference. Are they more of a hands-on person? Are they more visual? Are they more, they want to read it themselves? Everyone's a little bit different. Strategies for individualization. So make sure you're meeting those priority learning needs first. Make a list of things that you want to cover and what's most important. Repetition is key. These individuals are in the hospital, or perhaps they're sick in a clinic, or they're getting ready for surgery. Their mind isn't 100% into whatever you're teaching. So repetition is really important. There's a lot of different teaching methods, and your book talks about all of these. They're pretty self-explanatory. Demonstration, maybe we're going to demonstrate how to give a shot. Discussion and verbal teaching, that's probably the most common. We also give a lot of written information. You can do role-playing, lectures, or teaching aids. So visual aids, maybe the internet, maybe have a translator or some equipment. You always want to evaluate what you've taught them, make sure they understand. So maybe they're saying it back to you, maybe they're teaching it back to you. Maybe we're doing a checkoff list. Okay, we've got a bunch of things we want these individuals to learn, and we'll check it off as we go. We do simulation, we do a written test for them. There's a lot of different things. It's really important that we evaluate what we've taught our patients. I think it really depends on what you're teaching as to how you will evaluate it. Documentation. We've talked about this before. If you don't document it, it wasn't done, right? So it's really important that you document what you taught your patients. You're going to communicate the plan to other healthcare individuals, so we want everyone to know if we taught them about XYZ, that it's in the chart. And a lot of times charts today are set up for that, for you to be able to just check a box and say, yes, I educated my patient on this. That way they have documentation of it. It does provide a legal record to the patient in case something would come up in the future, and it is required for financial reimbursement from the hospital. So again, the computer systems are very well set up to do this, but if I was you, I would also leave a note in the patient's chart that just says, taught the patient how to get an IM shot today or a sub-Q shot today. This is how it went. It's also important that you include the patient's response. Maybe the patient didn't want to be taught. Maybe the patient refused teaching. But you still need to document that you were a part of that and that you tried to teach the patient. You need to include what methods you use and how you evaluate it as well. Lifespan considerations, obviously different for each lifespan, how we're going to teach. Newborns, they learn by interacting with their environment, right? They're not ready for some formalized teaching. We're not going to talk to the newborn. We're going to talk to the parents. We're going to educate them on important topics, maybe immunizations, normal growth, development, car seat safety. Those are things we would talk to parents about. Toddler and preschooler, the same. Okay, we're most likely going to talk to the parents here. You can talk to the kids. It's important to get down on their level and talk to them as well. But parents are going to be the most effective teachers. They're going to be able to reinforce a lot of these whatever we're teaching them about. School age and adolescence, a lot of these kids are really eager to learn. Some important topics we might teach them about would be nutrition, sleep, exercise, safety, learning how to deal with stress. So those are some things you could talk to school age and adolescent children about. It's probably not something you're going to come across frequently within like the hospital, but when we go do our public health clinicals, we're going to do teaching plans with kids, and you're going to go into school and you're going to teach them about things. And these, you'll have to develop a plan, show how you'll teach it, and how you're going to assess it. So those are some topics that you might include there. And then adult and older, they're motivated, by activities that enhance or maintain their self-concept. So that's what I've got on teaching and learning. We're going to talk more about this in class on Monday, and we will review everything. I will have a little review PowerPoint. And on Wednesday, we are going to do, not this Wednesday, I apologize. It'll be next Wednesday, lab number 7. I believe that's April 20th, if I'm looking at this schedule right. We will do a teaching learning activity. So what you guys are going to do, and this is worth 25 points, is I'm going to give you a case study of some sort, and you're going to be in a group, and I'm going to put you in a group, and you're going to come up with a teaching plan, and then you're going to present it to the class. Okay, so should be a fairly easy activity, but we're going to work on how to actually do a teaching plan and carry that out so you know how to do that in the future. If you guys have questions, email me. I'd be happy to answer them.